Hello, this is Paul Barr, Senior Writer for Hospitals and Health Networks magazine. Dr. David Feinberg, the President of UCLA Health System and CEO of UCLA Hospital System, is here to talk about how UCLA is undergoing a massive transformation of its operations. The change is designed to ready the system for the expected industry transition into providing value-based care. Thank you for joining us.
Absolutely. Thanks for having me.
Can you describe what UCLA did to prepare for value-based care?
Sure, but I think, Paul, probably it's best to give an overview of UCLA to start with. So our UCLA hospitals are 4 in number. We have 152 clinics in Southern California, and our purpose is to heal humankind one patient at a time. We do that by alleviating suffering, promoting health, and delivering acts of kindness. UCLA has had a long history of really phenomenal tertiary and quaternary care. We do more organ transplants than any hospital in the United States. But we hadn't always been known for being patient-centered. And I would think that the transformation really began when we chose as our true north patient-centeredness. Over the last 4 or 5 years, our patient satisfaction scores are now #1 in the country, both inpatient and outpatient. And that's why we're making the transformation. So we're not making it to prepare for changes in the marketplace. Rather, we're making it because it's our patients telling us that's what they need. They want care that's coordinated. They want care that's efficient, that's delivered with high quality, that's safe, that's culturally sensitive, that they're engaged in. That's what's driving us, and that's what's leading to our transformation. We've got a long way to go, but I think that's an important part of why we're doing this.
What kind of changes are you undergoing then as a result of that?
So we have decided that we're going to do what's right for the patient, even if it's wrong for our business, because we think the business will ultimately catch up. So examples of what we've done. Created a medical home for our chronically ill pediatric patients. We started with a couple hundred kids. We now have 2,000. Immediately saw a decrease in ER visits, decreased length of stay. Patient and family satisfaction went through the roof, and the same with providers. We created medical homes in all of our outpatient clinics. So we have care coordinators, pharmacists, behavioral health people, really making sure that nothing falls through the cracks. We want to treat each patient like it's my mom. So we want to get all the information right. We want to make sure that the handoffs between inpatient and outpatient go really, really smoothly. And we want to prevent hospitalization whenever we can. On the inpatient units, we're really, really focused on making sure you're getting the exact right care by the right people at the right time.
How did you develop your plan?
Well, it really came from a lot of discussions and a lot of listening. So it was listening to our patients, listening to our frontline staff, and listening to our fantastic doctors and nurses that provide all the care, to the really millions of patients that trust UCLA for their care. And by listening, and we brought in some outside expertise, we really believe that picking patient-centeredness as our true north was not only the right thing to do, the right way to train the doctors that we train and the other professionals that we train, but also would position us for the changes that are happening in the marketplace. So we spread out. We now have clinics throughout Southern California, into Orange County, moving up close to Ventura County line, and all the way. When we talk to patients, they told us they won't drive more than 4 miles in LA. Remember, we have bad traffic. They won't drive more than 4 miles for primary care visits. We put primary care offices every 4 miles in the areas that we're going into.
What would you say is one of the biggest challenges that you faced in the process?
Well, I think there's a couple of challenges. I would say the 2 biggest. One is it's really hard to change your business while you're running your business. It would be a lot easier if we could close for a year and reopen. So we have to continue to do kind of the old model of care while we're transitioning to the new model. But the biggest challenge is to make sure we get it right with every single patient we see. So when patients call us today, we get 5 patients by helicopter. When somebody finds out that their wife has a lump in a mammography, or an elderly parent fell and is bleeding tonight in the bathroom, or a child, writes in a poetry exercise at school that they're suicidal. The patient experience begins right then. And despite all the pressures that we have to transform our business and do everything, we have to take care of those families and those patients right now. We got to make sure that the care is the exact same care we'd want for our own family. And we have to do that while we're changing the business. So changing the business is hard. The purpose has helped us drive it. But the biggest challenge is get it right for the patient that's right in front of us.
Do you have any advice for a system or a hospital that's early on in this process of remaking itself?
Yeah, I would say the biggest advice I have is to use your ears and listen to your patients. Listen to a patient who comes to your system for complicated treatments or even for routine care, and ask them, what could you do to make it better? I mean, things that we've said, we now answer the phone at UCLA. This is UCLA Health System. Would you like to be seen today? So we offer same-day appointments for everybody. And that was what our patients told us, and our friends and neighbors that we treat in the community was necessary. So that came from patients. We have said, and we're not quite there yet, this is part of the transformation, we're going to change our waiting rooms because we heard this from our patients too. Pretty soon, the waiting rooms at UCLA will either be turned into clinical space or they'll be used as waiting rooms for our doctors because our patients will never wait. So we are really trying to create a place where when you come, you get the expectation that we've been waiting for you and we're prepared for you. And we know what you're going to need and the complexity of your care. And we've put it all together. It's actually in the waiting room waiting for you. So for other institutions, depending on where you are along this spectrum, I'd say use your ears, listen to your patients, and try to flip this whole provider-centric industry that we have around to one that's truly patient-centric.
Thank you for joining us today.
Oh, it's my pleasure. Thanks for having me.
This is Paul Barr for Hospitals and Health Networks magazine, and thank you for watching.